I have PCOS.
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 For me, it's quite simple. It is my hormones don't act the way they're supposed to.
There are many different faces to PCOS.
We diagnose PCOS using the Rotterdam criteria. It consists of 3 different criteria, and you need 2 out of those 3 criteria to have the diagnosis.
You have to have a woman who has menstrual irregularities or no periods at all. A vaginal ultrasound needs to show a classical architecture or appearance for polycystic ovaries. The woman either has to complain of hirsutism or excessive hair growth, or when you measure her hormone levels, when it comes to androgens, male hormones, they're abnormal.
I had no idea what it was until I found out I had it.
The absence of periods, the irregular periods.
You could be once a year, once every 9 months. I was breaking out like I was 16 and I was 25.
I had excessive facial hair.
Having obesity can also be a sign that you have it.
It's thought that in the United States, well over 50% of women that may have PCOS don't even know it.
I never did have a regular cycle, and yeah, I would always hear, girls in the locker room or whatever, oh yeah, I got my period again or whatever, and I just didn't.
I would have this awful racking pain.
My body was giving me signs that something was wrong, but I didn't know.
For many women, especially the younger women who are not yet interested in pregnancy, it's very, very important to control this at a young age. And I often like to refer to this as a silent struggle because this condition develops during their puberty or their teenage years, and they may suffer silently for many, many years.
So I was told that my ovaries were continuing to just make cyst after cyst after cyst.
They were twice the size they were supposed to be. They didn't work anymore. They were covered in scar tissue.
People often refer to the PCOS type ovary as having a pearl necklace appearance because there are numerous follicles around the outside of the periphery of the ovary. And it's simply because these women, every month, they start developing follicles, but none of them go to full maturity. Therefore, they have an abundant number of follicles that stay in the ovary, and that's how we get the term polycystic ovary.
An OB at that point, when I saw one, said that's the person who said, "You're never going to have kids."
And I felt like I was slammed with a diagnosis.
I was 20-something and trying to have kids like everybody else does, and I wasn't getting pregnant like everybody else was.
You're told your whole life you can't, you shouldn't conceive, you stay away from it, and then you try so hard.
What could I be doing? There must be something I could do better. There must be something that I'm doing wrong.
But I had a thing in the back of my head saying, you can't give up. This is, you're on this earth to be a mother. You'll find a way.
I was at many doctors before this, and nobody had figured out why I couldn't get pregnant.
Technically, that was the 3rd doctor I'd seen.
Our vision for the PCOS Center of Excellence was to promote PCOS awareness to the public, to patients, and to physicians, but also being able to have very comprehensive screening to be able to make a correct diagnosis, and then ultimately also to offer treatment in a variety of ways, all in one center of excellence.
We are hormonal specialists.
This is all we do. We do a very thorough assessment to understand why the patient is not ovulating rather than just starting them immediately on a fertility medication. So when you finally are able to make a diagnosis, there's a sense of relief because they know then that there's something that can be done to correct this problem.
Where has this guy been for the last 20 years?
Don't worry, we have a treatment plan for you and there's hope.
Because that hope is the only thing that gets you through the days you just want to cry.
And it's not something that happens to you, it's something you live with. And it's something that can be managed.
And all of a sudden, you have this reason now of why you can't have kids.
Our doctor said that, we would have kids and, not to worry. You're not alone and, you're not doing something wrong.
I know, it's not my fault.
These are all gut-wrenching problems that you need to, day in and day out, take care of these individuals.
There is treatment, and it's very effective.
You can do the reachable things.
I watched my diet. I didn't do any
strenuous exercises, just light activities.
And I didn't have to do it, you have to lose 40 pounds. It was like 5 pounds.
I tried to just really be good to my body.
The medical and emotional support that I got from fertility centers was, I wasn't expecting it.
I mean, because not only are you going through it, they're going through it with you, and so is your husband.
They treated us like family.
Whether I was in Crystal Lake or Buffalo Grove or in the city, wherever I was, there was a game plan. There was a team surrounding me that was doing whatever it took.
They were very excited to hear the heartbeat along with us. When we saw our doctor, he just came and gave us a hug. He was so excited for us.
Feeling the baby's kick for the first time. Or you think about calling your mother and telling her that you're pregnant.
You work so hard for it, and to finally hear it, really, 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 it's happy. It's a happy cry.
That's when your journey is real.
I knew I made the right choice.
And now you have something to show for all that hard work and pain and crying and tears.
They made sure every step of the way this was going to be a strong pregnancy, as strong as they could possibly make it.
I truly believe without my doctor, I would not be where I am today.
It's gonna be okay.
It is so going to be okay.
It's gonna be okay. Really is. I mean, you just gotta work for it, like I said. You do. You really have to work for it.
Our journey is our journey, and everybody's is going to be different, but it's the path that you take to get you where you're supposed to be.
He's precious, worth every moment.
My journey was meant to end here.